And I got a great guest with me this morning to discuss some of the statistics, the research out there on hormone therapy. I have Dr. Robert Seek, owner of Partel Pharmacy. He's a pharmacist over at Partel and owner of a compounding pharmacy right here in Las Vegas with a wealth of knowledge on breast cancer and hormone treatment. And he's here this morning to share his research, his background in the pharmacy world on some of the myths and the facts out there about hormone treatments and the risks to women out there. Welcome, Robert.
Good morning. Thank you for having me on once again. It's good to be here.
Yes, Robert's been on the show with me a few times and brought a wealth of knowledge. He's worked in the pharmacy industry for many of years. He's actually participated in clinical drug trials and brings a lot of knowledge to our listeners about medications that are out there and some of the things that people have listened to, the scares of hormone therapy. When we say, it's Breast Cancer Awareness Month, it's brought a lot of awareness to women out there to make sure they're doing their self-breast exams, getting their mammograms done, thermography done. There's a debate out there, even on hormone therapy. And Robert, as you know, this topic is a sensitive topic to me because my mother is a breast cancer survivor, and I didn't even do hormone therapy before she was diagnosed with breast cancer. And my mother, who has breast cancer, is actually on hormone therapy. Mm-hmm. So the benefits that it's brought her alone in life, and she was also, the big scares of, the estrogen receptors, the progesterone receptors, and she was positive for both estrogen and progesterone. She used Premarin back in the day. We used to harass her when we were kids about taking her medicine because she was hot flashing and having these symptoms. And I remember growing up how miserable going through menopause she was. And then here later in life, 55, she gets diagnosed with breast cancer. And, that study that came out in 2001 on breast cancer has scared a lot of women out there. It's brought a lot of myths to hormone therapy and women. And I know that you, from the pharmacy world, have been great, dug in detail with the research on this. And more women actually die of a heart attack or heart disease than they do from breast cancer. And the big thing is now the new research that's coming out is women that don't have estrogen are at higher risk of dying of a heart attack. And I think that's important for our listeners to really know out there that hormone therapy can be safe and it's effective.
Well, you're absolutely right. And, one of the things you pointed to that I really benefited from in my career was working in the drug industry for 10 years, actually managing clinical trials. I became a student of how to interpret data from various published studies. And as you know, I do a lot of consultations for patients and actually for physicians who ask for guidance on treatment of their patients because they know that I've developed some expertise reading the medical literature on hormone therapy. So the breast cancer topic is one that comes up quite often. So what I'll discuss on the show, you and I will have some back and forth and you'll ask me some questions and I have my opinions. And I never tell anyone, a medical practitioner like you, that just don't listen to my opinion because it's not just what I think, it's based on what the preponderance of the medical literature shows. And the unfortunate fact is there's just not legions of sales reps employed by pharmaceutical companies to go out there and show some of the information about the truths of hormone therapy. And Chrissy, I don't know if you know this, but my mother was diagnosed with breast cancer. I was a young guy. This was 1981. I was 10 years old. And she had 3 recurrences. She was a survivor for a long time. And unfortunately, she passed away in 2001. And I look back and I think now about, the general philosophy reviewing the medical literature in terms of breast cancer and what the evidence shows is pretty clear, even in the WHI and the HERS trial. Women who are estrogen dominated, which is either by the treatments that they're on. So we've talked before on the show how if you're on birth control pills for too long in your life, you do have an increased risk of breast cancer. So I know you do a lot with nutrition to metabolize the birth control pills properly. And then when women were typically treated traditionally 20 years ago, and we've been changing that philosophy for a long time now, during menopause, they get hot flashes, they go on estrogen. And the typical estrogen available was the Premarin, and then a progestin, which is not progesterone. You had the Prem Pro, or the medroxyprogesterone acetate. And the 2 large trials, WHI and the HERS trial, basically found that in thin women in particular, who didn't have the excess body fat to deposit some of these toxins in, because medroxyprogesterone acetate is a petroleum derivative and quite toxic and actually only marketed in North America. Other countries kept it out. Those women had a higher incidence of breast cancer, ovarian cancer, heart attack, and stroke.